When you have AIDS, people take it like it's finished. You're just waiting for the day to die.
Many people believe that being HIV positive is a death sentence. This is not true. If you are living with HIV, you can easily live 14 years or more if you take good care of yourself, follow a healthy diet, and get proper treatment for your diseases. But because an HIV positive person's immune system is vulnerable, it is vital that you obtain quick and effective treatment when you become ill.
And it's important for them to do this because every little infection that they get makes the disease progress a little bit faster.
People with HIV will eventually get opportunistic infections. You get these infections because your immune system is already weakened. Certain opportunistic infections, such as TB and pneumonia, can be prevented if you take prophylaxis. That means medicines that can prevent you from getting these infections in the first place.
I am of the opinion that tuberculosis and pneumocystis pneumonia is responsible for 65% of the deaths in the Eastern Cape.
Opportunistic infections can be treated also in people living with HIV.
We have access to most of the medicines we need to treat the opportunistic infections. We can treat, obviously, tuberculosis, and we can investigate for difficult presentations of tuberculosis. We can treat cryptococcus, which causes a very awful meningitis.
Apart from prolonging your life, early treatment of opportunistic diseases will also save the government money.
If you catch them early, there's no doubt that by avoiding hospital admissions of those patients, by treating your opportunistic infections early, you'll be able to reduce the amount of money spent by admitting that patient.
However, many patients and doctors are still ignorant about HIV. They believe that if a person is HIV positive, it is a waste of money to treat them, because they are suffering from an incurable disease. Other doctors know the disease can be cured, but still don't treat patients properly.
He came up to her, said, "What is the problem?" I just said that she had these things in her mouth and we were hoping something could be done to help. He took one look at her, at Doreen, and the maxillofacial dentist said to her that we see a lot of this, there's absolutely nothing we can do in her case.
I've had patients turned away in the emergency rooms or the casualties when they're found out that they're HIV positive and things like that.
Treatment is inaccessible, and when I'm talking of treatment, I'm not talking about the AZTs or the antiretroviral drugs, the triple combination. No, I'm talking of treatment, just the treatment that any person might get.
Those in government positions refute Tandotolo's claims. They say patients with HIV are treated just the same as other patients.
Our approach and policy is that we will deal with them and that no one will be turned back because he's HIV positive.
Even if a person is HIV/AIDS positive, if he's got an infection, that infection has to be treated.
In some hospitals, where such preventative medicine is given and opportunistic infections are treated, doctors struggle to get enough drugs to treat diseases.
Bactrim is a cheap drug and can prevent pneumonias in HIV patients, and I know many clinics I know of several clinics who are struggling to keep Bactrim even available for their patients.
At the moment, it seems as if the treatment of patients with HIV depends on the attitudes of the doctors and nurses.
There's a very isolated incidence wherein people with HIV are really treated for the opportunistic diseases.
I was having a shingles. Yeah, it's not a long time ago. I think last month. I did go one of the clinic here at Port Elizabeth. The doctor just said to me, "No, we can't do anything about this." And I told him that I'm HIV positive, and he said, "No, I know that this symptom is for people who are HIV positive, so I can't do nothing. I'm just going to give you just a pain tablets."
Even an HIV positive person hasn't got any symptoms, but he's sick, he goes to the hospital. He's encouraged to disclose to the doctor or to the healthcare worker. But the experience is that when this person discloses, it's fine in the first day. But the second time he comes for treatment, he's reminded that, no, remember, you're HIV positive. So there's no use of you coming here every time you feel something, because AIDS has no cure.
Lawrence referred me to Dr. Malan. Dr. Malan is just working with people who are HIV positive here in Port Elizabeth. He gave me an injection. 24 hours after I get the injection, and the shingles disappeared.
Because patients are treated inconsistently, many doctors feel there's an urgent need for a treatment protocol for HIV patients. A treatment protocol is a specific set of guidelines that doctors must follow when they treat patients.
I think at certain clinics, the staff simply aren't well enough trained in HIV. They haven't overcome their fear of dealing with HIV. And unless they are actually obliged to adhere to protocols on how to treat patients with HIV, they would prefer to ignore the problem. I don't think ignoring the problem of HIV is the way to cope with it at the moment.
My experience is that in the state sector, especially with more serious and immediately life-threatening opportunistic infections, no treatment is given.
Because they already put a lifespan. They've already given you a time. They're playing God with people here in KwaZulu-Natal. Doctors, if they feel you don't deserve that oxygen, they will practice euthanasia. It was done to me and a patient.
We've also experienced often that we've had interactions with the Gauteng provincial authorities in making guidelines for the treatment of HIV in an attempt to develop primary healthcare and secondary healthcare, where we have submitted these guidelines, and these guidelines were not accepted or were not responded to.
Even in KwaZulu-Natal, where the epidemic is at its worst, there are still no guidelines available for the treatment of HIV/AIDS.
Well, for HIV and AIDS treatment, we don't have a standing protocol which is standard throughout the province. We are working on that, but most of the basic, opportunistic infections are treatable with the kind of medication that's available on our essential drug lists, and therefore it doesn't require any special, protocol, as it were.
Now, the problem is that the hospital has a budget, and we have to decide at this stage what we can treat and what we can't treat. And for that, nobody's made a decision. And the best we can do as clinicians is to provide some guidelines that will help politicians decide. So we need some sort of political guidance and assistance to decide at which level they're going to stop.
The decision whether to stop or continue treatment is left to individual doctors. The doctor might think it is the patient's own fault for contracting the virus and decide not to treat him or her. Maybe the doctor feels it is not worth wasting medicine on a patient who's going to die anyway. The doctor might discharge an ill patient to home care because of a shortage of beds when the patient would have been better cared for in a hospital. All these things are still going on in our hospitals. Clear guidelines need to be laid down by the government to prevent this.
Because they undecided about which way to turn, they in fact are losing enormous amount of ground, and a decision to implement even a policy that's not perfect would be much better than not implementing anything at all.
Because of inadequate treatment of HIV/AIDS, people go to traditional healers in search of help.
Iyakusiza impela ngoba iyashaya masingakagcili kodwa mase sesakudla kakhulu ayisakusiza.
At least Mr. Makatini still advises his clients to wear condoms so that the virus which he claims has been killed does not return. Unlike some traditional doctors, he advises his clients to go to a Western doctor as well. Other traditional healers only send patients back once it is too late.
The traditional healers end up with our patients because we don't promise them any treatment. They know that the doctors are not going to do anything, so I must keep trying. Today is a traditional leader, the next day it's a priest who prays for me, and the next day is something else. And everybody else keeps cheating that I can manage, I can manage. But unfortunately, at the end of the day, they end up coming back to the hospital, and we see the last of the HIV patient when they come to die in the hospital.